As destructive as diabetes is, it pales in comparison to heart disease. Over 17 million people die every year from cardiovascular disease. It is the leading cause of death around the world. Nearly 1 out of every 3 people will die from this disease. The amount of people who die from cardiovascular disease is the equivalent of 4 jumbo jets crashing every single hour, every single day, every single year.
Hey, welcome back to another Thursday episode of Straight Talk Uncut. And of course, on Thursday, I talk about a documentary. And the documentary is called What the Health. Now, I saw the documentary on Netflix, but it's actually on YouTube also. I'm going to post a link to it below. And if it's still there, watch it there. It's about an hour, 30 minutes, I think. Now, here's my personal disclaimer. I'm not trying to stir up any trouble with this. I'm just looking for ways of being healthy personally. I'm not a proponent of veganism. I'm not a proponent of eating meat. I'm not a proponent of anything. Matter of fact, I didn't even know this was a heavy vegan based documentary until I saw it. I thought it was just like, there was a video or a documentary I saw a few years ago, which the guy ate McDonald's for like a month or something like that. I thought it was like one of those type documentaries. And here's another motto of mine that I have, and I can't remember where I got it from, but it's believe half of what you see and none of what you hear. Meaning, you have to investigate stuff for yourself. So, but it is interesting to watch. All right, so here it goes. I have 6 points that I pulled from this. So the first one was, and this is what I discovered, that according to this documentary, I haven't researched this to see if it's true or what. So this is from the documentary. Processed meat is just as dangerous as smoking cigarettes.
World Health Organization this morning has classified processed meat such as bacon and sausage as carcinogenic, directly involved in causing cancer in humans.
Processed meat is clearly linked to an increase in cancer.
Hot dogs or bacon could be just as dangerous as smoking cigarettes.
The World Health Organization had looked at over 800 studies from 10 different countries, finding a direct consuming processed meat and cancer. Just 1 serving of deli meats daily increases your risks of colorectal cancer by 18%. I had no idea that what we ate affected cancer rates, but I never felt like I had eaten a lot of processed meats until I realized that processed meat includes hot dogs, bacon, sausage, salami, ham, pepperoni, cold cuts, and deli slices, basically everything I grew up eating. The World Health Organization classifies processed meat as a Group 1 carcinogen, the same group as cigarettes, asbestos, and plutonium. If processed meats are labeled the same as cigarettes, how is it even legal for kids to be eating this way? I thought this was...
Yeah. So, crazy, right? I mean, now you don't have to be a conspiracy theorist to know this stuff. But my thing is, when they make the big move about this, non-smoking campaign, even what's that organization called? Truth. Why won't they say, hey, don't smoke and don't eat processed meat? If this documentary can correlate those two, why can't people against smoking correlate those two as well? I don't get it. Anyway, point number 2. Sugar doesn't cause diabetes. This was really shocking to me because I thought diabetes had something to do with sugar. I don't know why. I know it's insulin levels or something, but I thought sugar or genetics was the reason. But according to this documentary,
sugar play in causing diabetes?
It drives me crazy. Diabetes is not and never was caused by eating a high carbohydrate diet, and it's not caused by eating sugar. The cause of diabetes is a diet that builds up the amount of fat into the blood. I'm talking about a typical meat-based, animal-based diet. You can look into the muscle cells of the human body and you find that they're building up tiny particles of fat that's causing insulin resistance. What that means is the sugar that is naturally from the foods that you're eating can't get into the cells where it belongs. It builds up in the blood, and that's diabetes.
Said that you get diabetic because of carbs. They did a huge study in that EPIC study, 500,000 people. carbs consumption was inversely related with diabetes. In other words, the more carbs someone ate, the less diabetes they had.
Like, why is this not like on everything? Why don't we know this? Well, why don't I know this? I don't know what you know. Maybe you know it. Maybe I'm the only person on the planet that's into not knowing. Maybe it's just me and, I don't know, this guy from the documentary. What's his name? Kip. Maybe it's me and Kip, the only people that know. Thanks Kip, for uncovering that sugar doesn't cause diabetes. Thanks for researching that, going out doing the interviews and things like that. All right. Number 3, what happens when we eat meat, and have we been lied to about alcohol, about consuming alcohol and sugar? Going back to the point number 2, have we been lied to about what happens when you drink alcohol and sugar?
For my health, or else I'm not going to be here for my family.
When we speak of heart disease, I would say the role of alcohol is pretty small. The role of sugar is very small too. Smoking is big, but the good news is that most people have quit or never did smoke. The problem with animal-based diet, its contribution to heart disease is huge and it is pervasive.
All this expensive imaging, procedures, bypasses, medication, none of which has one solitary single thing to do with the causation of the illness. So you die of a completely benign foodborne illness that never had its causation treated.
When we eat these kind of dead meat bacteria toxins, within minutes, you get this burst of inflammation within your system such that you basically paralyze your arteries. You get this stiffening of the arteries, their inability to relax normally in half. So it's not like decades down the road eating unhealthy, there'll be some damage. No, we're talking damage right then and there within minutes of it going into our mouth.
You see what I'm saying? So is any of this like earth-shattering to you? Maybe if you have health problems, you know that. And I do. I have asthma. And that's the reason why. Matter of fact, I'm going to tell you a brief story. So I finished my workout this morning. And I hadn't used my inhaler for about a year. My asthma inhaler. I have asthma, right? I hadn't used my rescue inhaler for about a year. And it's because I was in this research program about asthma. I got off all my medications except for my one preventative for most of a year, because I think it's lasted like a year and a half, a year and a half. So the first 6 months was like getting the new drug they were using inside my system. So a year after, no, not one time did I use my inhaler. I was biking, I was working out, didn't use my inhaler. So probably last week is when I had to start using my inhaler. And it's because I got off the drug the last part of December. That's when I got off the drug. And they told me it has a half-life of about 30 days. Yeah, 30 days. And it's been about 30 days. That's why I'm like, you know what, man? This is crazy. That's why I'm so interested in what can I do to help this, so I won't have to be on medications for the rest of my life. Okay, point number 4. Dairy will straight kill you, according to this documentary.
But I thought cholesterol and saturated fat wasn't an issue anymore.
You know, these saturated fat studies that have come out trying to vindicate saturated fat? This is a campaign by the dairy industry, right? Number one source of saturated fat is dairy. It's not meat. 2008, the global dairy industry got together at a meeting and explicitly, read their agenda, was to neutralize the negative impact of milk fat by regulators and medical professionals, unquote. So what did they do? They funded studies.
The main study that started the whole saturated fat media craze was funded by the National Dairy Council.
Foods and autoimmune diseases. And so that can show itself up as excessive production of mucus and exacerbation of asthma in kids who are prone to that, and even adults. And also there's an association between dairy foods and multiple sclerosis and type 1 diabetes, which is an autoimmune disease, and other rheumatologic problems.
Cow's milk is baby calf growth fluid. That's what the stuff is. There's absolutely no child or human on earth who actually needs the milk of a cow any more than they need the milk of a giraffe or a mouse.
Most people in the world are lactose intolerant. I mean, that's the normal state of affairs. Why would your body create this enzyme to digest lactose after weaning, after infancy? It doesn't make any sense.
73% of African Americans are lactose intolerant, 95% of Asians, roughly 70% of Native Americans, and about 53% of Hispanic Americans are lactose intolerant. Our government is encouraging Americans of color to eat foods that it knows is going to make them ill. Ultimately, what that boils down to is the government is telling me as an African American to eat food that's going to make me ill for no health benefit so that it will benefit dairy farmers. That's a form of institutionalized racism.
Yeah, milk is a risky food for human consumption.
Diabetes.
I mean, this is a food made for baby cows. Cow milk protein gets into the bloodstream, and the body says, hey, this isn't supposed to be in the bloodstream. It makes antibodies to the cow milk protein, which then attack the pancreas and destroy the pancreas.
How is this possible that ADA wouldn't have this forefront on their website? Why wouldn't they be warning all parents about this?
Isn't milk supposed to do the body good? Come on, like dairy, all dairy, yogurt. I have Greek yogurt in the fridge now. I eat Greek yogurt every day. But you're gonna tell me that dairy is killing me? It's almost like pick your poison. What's going? You either smoke, drink, try to eat healthy. You think you're eating healthy. Point number 5: chicken, poultry, and eggs will kill you.
Cancer, in the standpoint of cardiovascular disease, that animal protein plays an enormous role.
Is chicken better?
It's a question of whether you want to be shot or hung.
The flesh food that I would eliminate from the American diet would be poultry, would be turkey and chicken. A brilliant advertising campaign has convinced people that, oh, it's white meat, it's healthier.
The leading source of sodium in the American diet for adult is chicken. It can be labeled all natural chicken, but be injected with this salt water, I think up to 800 milligrams of sodium.
Heterocyclic amines are clear-cut carcinogens, and they can form in any kind of meat as it's heated, as it's cooked. But by far the biggest source is chicken.
So just on sheer volume, it's the #1 source, eggs being close behind.
I'd never really thought about eggs much. I just thought of them as a standard part of a healthy diet. But then I found a study suggesting that eating just 1 egg a day can be as bad as smoking 5 cigarettes per day for life expectancy.
The yolk of a hen's egg is the most concentrated glom of saturated fat and cholesterol. It is made to run a baby chicken for 21 days with no outside energy. It is pure fat and cholesterol. And when we put that into our bloodstream, it coats our red blood cells. Our blood gets thicker and more viscous. It changes our hormone levels. It raises our cholesterol levels. There's nothing healthy about eating the yolk of the egg.
Now, I gotta say, this one was probably this one was probably the one I was like, man, that cannot be true, right? And I'm not a big beef eater, but I eat chicken, I eat turkey bacon, ground turkey, and I eat a shit ton of eggs. So this one was like, come on, man. You mean to tell me all these years, don't eat red meat. Red meat is bad. Now it's not just red meat, it's all meat, it's chicken and poultry and eggs. Now, I know there was a point where I was only eating egg whites. You know, there was like, all the cholesterol is in the egg yolk. So eat the egg white. So just egg yolks. And then I saw something and it proved that, no, that's a myth. That's been debunked. The whole egg is good for you. And so I started eating the whole egg. Now they're saying, is back to it. Not only the egg, but the chicken. And it's like, what do you eat then? I know this thing is geared toward a plant-based diet. The extreme level that they say this stuff will harm you. Matter of fact, if I don't post the clip, there was one where the guy said, it's not like it's going to hurt you down the line eating meat. It hurts you as soon as you ingest it. As soon as you eat it. It's direct. It's a direct effect. Like eat effect. It's not like it builds up down the line and you can like. I think there was even one point where one doctor said, it's not like you can do like a half vegan, half meat-based diet. It's like you gotta be meat free. You can't eat any meat. So I'm like, no sausage? What? No bacon? And so the last point I want to make, is this a conspiracy? Is there a conspiracy to enslave America with food?
To identify a prevention and a cure for diabetes, but in the meantime, to improve the lives of all people who are affected by diabetes.
And what's the best way to prevent this?
For type 2 diabetes, it's unclear. We can't prevent type 2 diabetes in everybody.
When we're doing the research, we came across a lot of studies that said that you actually could potentially cure or reverse diabetes with a purely plant-based diet.
I don't believe there's sufficient evidence to demonstrate that.
How does it compare to the ADA diet that you recommend?
We don't recommend a specific diet. We recommend healthy eating.
The one that's on the website.
We recommend healthy eating.
Do you have a whole list of exact day-to-day, the meal plan, the whole meal plan?
All they are selections of foods to consider. We do not have a diabetes diet.
But with that selections, that you consider that plan compared to a plant-based plan?
No one's done that study.
We found actually some studies, that a 74-week study found that low-fat vegan diet versus the ADA plan in type 2.
I think we're done here. I'm not gonna get into an argument about.
Oh no, I was just wanting the studies of if this is true or if it shows that.
Any diet works. Any diet works if people follow it.
But if it's a diet that's not the proper diet, like if anyone follows a diet that they eat
I can't tell you what a proper diet is. I can tell you what an improper diet is.
So then we can talk about the good diets. I'm not sure why.
I'm not going to get into that.
Into diet?
No.
Why not?
If that's where you want to go with this, I'm sorry, I'm not the person that you should be talking to.
And why is that though?
If that's what you want to get into, I'm not the person you need to be talking to.
Who do we talk to about diet?
You can talk to anybody you want.
But that's interesting though. Why not recommend a diet?
Because the data don't exist to support it.
But if we see data that we looked up that supports it with, like, the NIH, in Europe, the European Association of Studies.
We're done. I'm sorry. I'm not going to get into that argument with you.
No, it's not an argument.
I'm not going to get into the argument.
Why is it an argument? It's just talking about in European study of diabetes and other places that have studies. Why?
There are lots of studies.
Why is it even an argument?
There are lots of studies in the literature, many of which have never been replicated or, frankly, are wrong. That's why we do peer review, okay?
The European Association of Study of Diabetes has been peer reviewed? Or
I don't know what study you're referring to, and in the absence of being able to see that study, I'm not going to comment.
I could show it to you.
I'm sorry, I don't have the time for that.
I just don't understand why it's an argument, though. Okay.
Even if there were only a slight chance, why were they recommending people to actually eat these foods linked to diabetes? It seemed all of the large health organizations were encouraging people to eat the very foods linked to the diseases they're supposed to be fighting against. American Heart Association promoting beef, American Cancer Society promoting processed meat, pink ribbons on dairy products, and bacon-wrapped shrimp on American Diabetes Association. And then it all came together. What if? And there it was. The American Diabetes Association was taking money from Dannon, one of the world's largest dairy yogurt producers, Kraft Foods, makers of Velveeta processed cheese, Oscar Mayer processed meats, Lunchables processed kids meals, and Bumblebee Foods, makers of processed canned meats. American Cancer Society was taking money from Tyson, one of the world's largest meat producers, and Yum Brand, owner of Pizza Hut, KFC, and Taco Bell. Susan G. Komen was supposed to be fighting breast cancer, was corporate partnering with KFC, Dietz Watson Processed Meats, and Yoplait Yogurt.
And the American Heart Association was probably the most disturbing of all, taking hundreds of thousands of dollars from the beef industry, poultry and dairy producers, and millions from fast food and processed food manufacturers. Every single one of these organizations was taking money from meat and dairy companies that are associated with the causes of these diseases. This would be like the American Lung Association taking money from the tobacco industry. Prominent surgeon. But before we could get inside the building, the hospital's media relations manager stopped us.
Actually, I understand that Dr. said that you could film here today, but unfortunately that's not going to be able to happen. I know that he advocates for patients changing their diets, but the hospital makes money off these surgeries, and the reality is he does too. So we can't do anything that's going to negatively impact the hospital, so unfortunately you're not going to be able to film here today.
And you see what I'm saying? See, the thing about these documentaries is, just like, you know, when Michael Moore was doing all his documentaries, they're clever. You know, again, believe half of what you see and none of what you hear. But the thing about it is, like with a plant-based diet, okay? How do I know where the plants are coming from? How do I know how they were grown? Like what kind of pesticides were used? Now there's also been stuff showing that even when things are like non-GMO and pesticide free, if they are somewhere close to where, you know, you have a farm that's plant-based, non-pesticide or whatever, but is it sheltered from outside elements? Is there no pollution or I don't know how it works, but I'm just saying, is anything perfect? I don't think so. I don't think anything is perfect. I remember there was this outbreak of something with bagged, when you buy bagged spinach or bagged lettuce or whatever. I remember that was making people sick because some got contaminated, and all of this lettuce and stuff was making people sick. And I eat a lot of bagged or prepackaged spinach. That's organic, you know, prepackaged spinach, baby spinach, kale, all that stuff. And I remember this. So it was like, what? So I guess you have to pick your poison. I guess you really have to pick your poison. I'm going to cut out the stuff that I know that affect my health, like milk. I remember when I was little, when I was a little chubby kid, I remember my doctor telling my mom, you got to cut out the whole milk, because I used to drink a lot. Like when we would go on field trips or whatever, anything having to do with school or any kind of like get together, everybody else would be drinking sodas, and I would be drinking the tall, skinny boxes of milk. Just drinking milk. And that's what I drink, whole fat milk, right? When we would when people would go make a run for like sodas or something like that, because I was in the band, if they went and made run for sodas or food and stuff like that, everybody would get sodas, and they would always have a carton of milk, because they knew that's all I drink was milk. And I was a fat kid, like not my whole childhood, but there was a point that I just blew up, right? And so I know, and even my doctor told me, like, yeah, dairy affects asthma. And he's actually even mentioned, because my daughter, she has asthma way worse than I do, and allergies also. And I know that's one of the things they tell her to cut out. So I can get with that. But poultry, I've never once heard anything about poultry being bad for you. And then these organizations getting sponsored by the stuff they say will harm you. Is it a conspiracy? I don't know, man. I don't know. It's something to pique your interest for sure, especially when you think of all these, like alcohol, smoking. You think these are the worst things on the planet, alcohol, smoking, and drugs. But then the stuff that you need to live, you don't need cigarettes to live. You don't need alcohol to live, right? But you need food to live. So you're going to tell me these things are the things that's killing me? The stuff that I need to live is killing me? So that's it, man. I know this is a little different, but each Thursday, just depending on what documentary I do. And I may even add in movie reviews or something like that on Thursday. But yeah, each one is going to be different. Each one is going to bring out some different points of views from me. So that's it. And hopefully I'll be able to put this up with no problems. That's it for the episode. By the way, I was recording this episode with the rear-facing camera because I'm recording in 4K just so I can have a little more latitude when I edit. The thing about it is I can't see myself, and also I'm limited to 5 minutes video. And that's why I did the cuts the way I did. So it's just something I'm testing to see if I want to step up to a 4K camera. I just want to see if my computer system can process the video. So that's it. Like, subscribe, comment. Go to goodfunshirts.com. Buy yourself a shirt. Buy yourself something, phone case, something. Thumbs up the video if you like it. Tell us at straighttalkuncut.com is where you can see comments and answer them on the podcast. Once I get enough questions, I'll answer them on the channel. That's it, man. That's it. Like I always say, I don't know a lot, but what I do know, I talk straight about. This has been Straight Talk Uncut. Thank you guys for listening. Talk to you next episode.